Well, we are live and we're very happy to see all of you logging in for our week here at Live with Dr. McDougall. But today we have a very special guest that is taking a while to get him back, but we're very glad to see Dr. Anthony Lim here as a guest today. And he is the medical director of the Dr. McDougall 10-day program. He presents there for many other programs, and then we'll ask Dr. Lim to tell us a little bit about what he's doing these days, also at True North, and we'll have a fun time today. And I'm Gustavo Tolosa, and I'm in Dallas, and thanks to this wonderful technology, we can communicate. Dr. Lim is in Santa Rosa, California, I believe, and I want to welcome to you. How are you doing, Dr. Lim?
Great to see you, Gustavo. I'm doing really well. Yeah.
Very good. Very good. I can't keep up with your fast developing professional life. So tell us, what are you doing these days besides, of course, working with Dr. McDougall? What other activities do you have?
Yeah. So I divide my time three ways. First, as the medical director of the McDougall Program, I oversee the clinical care of all the patients that come through the 10-day programs and the employee programs, as well as patients who see me during the 3-day intensive study weekends or the advanced study weekends. In fact, starting Saturday, we have 70 employees coming from Whole Foods as part of their annual 8-day immersion program. And so myself and two other doctors will be seeing all of them and taking good care of them. And if this program is like any of the past, we will see pretty remarkable results in a very short period of time, which is a testament to the power of diet and lifestyle. So that's one of my hats. My other hat is as a staff physician at True North Health Center based in Santa Rosa. It's one of the only medically supervised water fasting facilities in the world, certainly the largest. We supervise medical fasts, and we try to help patients transition again to a whole food, plant-based way of eating. They're even stricter there: no salt, no oil, no sugar. So there are some subtle differences in the diet between True North and the McDougall plan, though I would say they are far more similar than they are different. And then last, I work part-time at Kaiser Permanente in Santa Rosa. In fact, I was just there yesterday afternoon seeing 11 patients in the afternoon. I work in urgent care settings, oftentimes seeing patients when they can't get in to see their doctor. And I also teach their plant-based support group. I co-lead that with a nutritionist, Melanie Larson, and we've been doing that since 2015. The class was started over 8 years ago by a cardiologist who retired named Dr. Sandy Warren. And I'm proud to say it's the #1 subscribed class in all of Kaiser Santa Rosa. So we get anywhere from 70 to 80 people every month. And Dr. McDougall has been a guest speaker there. We've also had a good friend of mine, Dr. Ben Brown, who works very closely with Dr. Dean Ornish. He came as a guest speaker. Who knows, Gustavo, maybe we'll have you come one of these days and share your story. So I spend my time in these three different settings, and I really enjoy that. It gives me sort of a different perspective on what's going on in healthcare and within the nutrition and healthy lifestyle movement. And I see patients from all walks of life. And honestly, I wouldn't have it any other way.
That sounds like a very busy life. Besides, you have a wonderful wife and a child.
I do. My wife, Jean, is my soulmate and life partner, for better or for worse.
All right.
She's my rock. She's a dermatologist who practices at Kaiser Santa Rosa as well. Uh-huh. And then Joshua just turned 10. And Julia is my mischievous little 5-year-old daughter. And so this evening I'll be putting on my other hat and I'll be coaching Joshua's soccer team. They're close to undefeated this season, so they're doing well. They're 4-1.
Good. And I have to. Oops, I hear a feedback. Okay. I have to also mention that you have a degree in law.
I do. I'm a lawyer and a doctor. I MD/JD, and in my 20s, I explored multiple fields before settling on medicine. So I worked at Bain & Company, which is a management consulting company, and explored the world of business. I went to Harvard for law school, and was going to go into public defense or become a public defender. I taught 5th through 8th grade math through AmeriCorps in Dorchester for a year. I went to China for a year and studied Mandarin, and then I did a computer science program for 1 year. So basically, it was my Renaissance period of exploring everything before coming full circle back to pre-medicine, which I was in undergrad, and finding my true calling.
Wow.
Yeah, but I did take the bar exam in California. So, if medicine doesn't work out in the end and I need a second career, then I can always fall back on law. But somehow I don't think it's going to go there. I'm pretty happy where I'm at, and there's a lot of work to be done.
But so let's get started then for today. We had some questions. Maybe you want to address those first, and then you had a presentation you wanted to share with us, or any order you want to use.
Okay, yeah. So thanks everyone for sending some questions. Gustavo forwarded them to me yesterday evening, so I had a chance to look at them and pick a few that I thought would be appropriate. One of them, let's see, let's pull it up right here. So we had one question that I have had a history of gout. What plant-based foods should I avoid? And I think this is a good one for a number of reasons. So first, just a little bit of background on gout. Gout is it's a recurrent inflammatory arthritis that primarily affects men, and is often known or coined as the king's disease, because we saw it in the monarchs. King Henry VIII is a well-known example, and it's indicative of the fact that it's a disease that comes from people who are wealthy, who eat a lot of meat and drink a lot of alcohol, and so there's not much disagreement amongst. I mean, even at Kaiser, their Department of Urology, for patients who come in with recurrent gout, at the top of their list of recommendations is to cut back or eliminate animal foods and alcohol. So I certainly think, if you're trying to avoid gout, the number one thing you can do is eliminate animal foods from your diet. So meat, seafood, shellfish, eggs, all of that. And that's certainly consistent with the McDougall diet and a whole food plant-based diet. There's concern about whether vegetables rich in purines, which is the precursor for uric acid, whether those are linked with gout. And really, the bottom line is there's not good evidence that eating a diet rich in vegetables that have purines in it is going to cause gout. And that explains why, when we look at populations around the world that over history that have eaten a primarily plant-based diet, even if they're eating whole grains and vegetables rich in purines, gout was basically not a factor. It was unknown. So I would not, as long as you're sticking with fruits, vegetables, legumes, and grains, the four basic parts of a whole food plant-based diet, then I don't think you need to worry. And then I would minimize or cut out alcohol, because the metabolism of alcohol is thought to increase uric acid production by the liver. So that can certainly be one trigger food for people. Aside from that, same thing with kidney stones. Stay very well hydrated. and avoid getting dehydrated, because that can cause precipitation of the uric acid crystals in the joints and lead to an acute gout flare. One thing I wanted to caution people is that we have a lot of overweight, obese patients come into the McDougall program or True North who have a history of gout. And we actually caution them that even if they were 100% plant-based, eliminated all oils and all animal products, that they may find that as they lose weight, a gout flare could be precipitated. And the reason for this, it's not due to their diet, because they've cut out the main offenders, but actually their uric acid is precipitating out into their bloodstream as it's coming out of their fat and out of their joint spaces, and that can certainly trigger an attack. So I've had a patient recently who I actually recommended that he stay on his allopurinol, which is one of the main prevention medications for gout, while he was losing weight. And then in the future, once he's achieved his ideal body weight, then he's certainly more than welcome to do a trial off of the medication. And my prediction would be that he would not get a further gout flare. So that's just one note, because unlike diabetes or unlike high blood pressure, where we typically take people off their medications right from the start, gout does fall into an exception category there. Any questions, Gustavo, on that, or should I move on to the next?
Let's just move on.
Perfect. Let's see what the other. Okay, so I got a good question from a patient. What is the best way to reverse peripheral arterial disease? And peripheral arterial disease, just as background, it refers to diseases of the blood vessels outside the heart and the brain. So if we have blocked vessels of the heart, we call that coronary artery disease. If you have a blocked vessel in the brain, that can cause a stroke. But we've got vessels going throughout our entire body, to our legs, to our feet, to our intestines, to our stomach, to our arms and legs. And along the way, any of these can become blocked. What I think is important for people to realize is that this is really the exact same process that we are seeing in the heart and the brain when we have a heart attack or when we have a stroke. It's just a different location. And so we're not really talking about a separate disease process. We're talking about the exact same disease process of atherosclerosis or arteriosclerosis that is a result of our standard American diet that is rich in processed foods, meat, and oil. And it's literally just a different anatomic location. And for that reason, I still remember when I first attended the International Plantrician Nutrition Conference in San Diego back in 2015. And I heard a talk on erectile dysfunction. And Terry Mason gave the talk, and he referred to erectile dysfunction as the canary in the coal mine. And that I've never forgotten that, because basically what he says is that, for these young men in their 30s or 20s now, where erectile dysfunction is increasingly becoming a problem, this is sort of a signal of the fact that they're already developing atherosclerosis at an early age. And you can use that on the one hand. I mean, in typical medical practice, in a rush setting, you give them their Viagra, you tell them how to use it, you caution them on the side effects. But if you take that a level further, you can actually explain to them that they are having a blockage of the arteries to their penis, and that this is an indication that they need to change their diet, and that through adopting something like the McDougall plan or diet similar to True North, that they could actually reverse that and improve the blood flow to their genitals, and hopefully not need to take Viagra. And more importantly, avoid a stroke and heart attack later on in life by taking care of the health of their arteries. In other words, by taking care of your peripheral arterial disease through healthy lifestyle, exercise, and diet, you're also taking care of the arteries of your heart and your brain. And this is a very important point for people to realize. Of course, if you are smoking, then you should stop smoking. That greatly increases your risk of developing peripheral arterial disease. And make sure that you stay very physically active. I don't think we talk enough about the importance of exercise and physical movement within this, if you want to call it a whole food plant-based movement. One of the things that paleo, as much as I have concerns about it, one of the features that I like about it is that they do really focus a lot on exercise and daily movement. And so certainly, along with making sure that you're putting in the right foods into your system, spending 30 minutes a day in some form of exercise that's safe and appropriate to your level of fitness will also help improve your circulation and begin that process of reversing your peripheral arterial disease.
So I just want to mention that we have always, well, not always, but very often people writing about oil. And there seems to be this need that, or people, I guess people feel like they need to have oil, and they ask about olive oil and corn oil and rapeseed oil and coconut oil. And I would like for you to give us your input, your views on any kind of oil, or if there is actually a difference from one oil to another oil, and why Dr. McDougall doesn't allow that, and I guess a True North either. So, Dr. Lim, let's see what you have to say about oil.
Yeah, that's a great question, Gustavo. There is so much controversy around oil, and I feel sorry for people out there because the headlines change day to day, and so it's very hard for them to know what to think. I like to keep things simple. So if we get right back to what the terms we generally use for this whole way of eating, I think each term really does matter. Whole food, plant-based lifestyle or diet, right? And so whole food is food in as natural a form as possible, and minimally to no processing, and fruits, vegetables, legumes, and grains all fall within that. And then plant-based, certainly, pretty self-explanatory, not animal-based. So eggs, milk, dairy, meat, fish, shellfish, all of that. So if we just look at oil on this framework, then one of the biggest problems with oil is that it is heavily processed. I mean, let's just take a tablespoon of olive oil. It takes over 40 olives to produce 1 tablespoon of olive oil. And as a result of this processing, what you end up with is a food that is the most calorically dense food out there. I mean, oil is more calorically dense than a fatty steak. It's more calorically dense even than butter. So I would lump butter and oil in the same category, but just to put it where in its rightful place, oil is the most calorically dense. It's 4,000 calories per pound. It's at the exact opposite end of the spectrum compared with, say, raw vegetables like cucumber and spinach, which are going to be less than 100 calories per pound. So and considering that the U.S. has over 2/3 of the nation overweight or obese, the idea that we would be telling a nation that has an epidemic of obesity to increase oil intake, which is the number one calorically dense food, completely makes no sense, regardless of what kind of oil. I don't care whether it's coconut oil. I don't care whether it's olive oil. So just to wrap up on oils, it's been shown to lead to increase in atherosclerotic plaques. It's the most calorically dense food out there in a nation that's already overweight and obese, not to mention a global epidemic. And it's very subject to oxidation. I think that it doesn't really have a place in a whole food plant-based way of eating. For those people who are not struggling with weight issues and using the minimal amount possible, I don't really take issue with it. And then to the extent they are using oil, I certainly think that olive oil, coconut oil are healthier forms than, say, lard and butter. The idea of, what I used to do, which was sort of just like taking the olive oil dispenser and just pouring it on, thinking that this was heart healthy, is really a misconception problem. And I should say that I recently came back from a cruise on the Caribbean, and we were on the boat. I was doing a snorkeling trip, and a little boat pulled up with a guy just filled with coconuts. And I saw the amount of work it took for him to open up the coconut with his machete. And then I bought 2 coconuts. I gave one to my wife and kids, and I ate one. And it was absolutely divine. It was delicious. So if people want to get coconut oil, they are more than welcome to get their whatever tool of choice and expend the calories it takes to open up that coconut, and then expend the amount of calories it takes to get in there and scoop each bite out. And if they want to enjoy that on sort of a limited basis, because again, it is a calorically dense food, but nothing compared to coconut oil, then I think that would be a very reasonable treat to have as a reward every now and then. And if people really, if people want avocado oil, yesterday I made a salad and I got this beautiful ripe avocado and I cut half of it, and I put slices on my salad. If people want to get their avocado oil, then eat the avocado. If people want to get their coconut oil, then eat the coconut. Just always bring it back to that simple 2-part principle. Is it whole food? Is it plant-based? If the answer is yes and yes, green light. If the answer is no, then yellow or red light. Greger puts olive oil as a yellow light food, meaning minimum amount. Dr. McDougall, in classic Dr. McDougall fashion, is none. Moderation is not an option. So you really do have to be careful when it comes to that.
You do. Thank you. Well, I think oil is kind of one of those addictive substances. It seems that when you add oil, people in some experiments that I've heard of, or even Chef AJ as a chef says that when you add oil to food, for some reason it stops the satiation mechanism and it makes a person want to eat more. So I don't know up to what degree, but
yeah. Well, and that's Gustavo, you bring an important point, right? And I talk a lot about this because I give a talk on behavioral change at every McDougall program. And, let's just pick up with what Dr. McDougall's famous quote, moderation is not an option. I agree with that, but I think that there's a corollary principle that has to go along with it. Know thyself. In other words, for the areas of my life where moderation is not an option are going to be different from the areas of Gustavo's life where moderation is not an option, are going to be different from this patient's areas where moderation is not an option. You've got to know thyself. I could have a piece of my son's candy on Halloween that's just pure sugar, and it is not going to trigger me. It's not going to make me eat that piece of candy and then want to eat the entire bag of what he's collected. But I have now met plenty of patients where sugar is a huge trigger food for them. And a little bit just makes them want a lot more. They're not happy with that little bit. If that's the case for you, then you can't open up that Pandora's box. So now bringing it back to oil, if a little bit of oil on something just makes you like all of a sudden just go raw and want to eat, tons of food just packed with oil, then clearly that is a trigger food for you. But at the same time, I've been at restaurants where they've mistakenly brought a dressing that has olive oil mixed in. It's not a trigger food for me. In my case, what's a trigger? I have this slide in my presentation of Game of Thrones, because when I graduated from medical residency, a close friend of mine gave me the entire first 3 seasons of Game of Thrones, which is this sort of drama. Probably everyone out there knows it. This drama series based on knights and medieval times. It was a hit series. And I watched the very first episode. And at the end of it, I realized this is going nowhere good. Like I do not have self-restraint in this area. I cannot just watch like one episode every week or one episode even every few days. I knew that I was going to binge watch, that I was on the road to staying up for 72 hours straight to just try and get through the series, and that whatever episodes were left remaining, that was all that was on my mind. And so knowing that about myself, I packed up all of the DVDs and I gave them back to my friend Jimmy. And I said, Jimmy, I can't handle this. It's going to trigger me into wanting to watch the whole thing. So that's me knowing myself. And it's for that reason that a couple years ago, Colin Kaepernick, he's the quarterback for the San Francisco 49ers, was a few years back. When it was really exciting watching sort of his ascendancy on the team as quarterback. I ended up watching all the games. And after that season, I swore off football for a period of time because I couldn't just watch like one quarter of a game. So I do think that along with moderation is not an option. You've got to know yourself. So, and get real with yourself and be honest and see those areas where a little bit does more harm than it does good. And if that's the case, then, get rid of it. It's like the alcoholic. You don't offer the alcoholic one glass of wine. It's going to do more detriment than harm. But at the same time, if it's not a trigger for you, then maybe, you can have a little bit and leave it at that and enjoy that little bit. And so I think each person needs to be mature enough to reach those decisions for themselves.
Thank you, Dr. Lim. Let's see if you want to either do show us the presentation that you had. We have about 20 minutes left.
Okay. So I wanted to share.
Before, let me just say one very quick thing. Someone was asking about, we have a whole webinar that I did with Dr. McDougall on SIBO. This person here is asking about that topic. If you go to drmcdougall.com website and you go to the webinar page, there is a whole webinar on that topic. So that way I'm sure you will find the answer that you're looking for in that webinar. Anyway, thank you, Dr. Let's go on.
I just wanted to share a recent fun transformational story that's very close to home and is my own brother, my own older brother, Jonathan. He is the responsible party for, at one point, getting myself and both my parents to eat a paleo-like diet. This was back in 2012. And since then, since I've come to adopt a whole food plant-based lifestyle, I've managed to convert both my parents and most recently my brother. And so I wanted to share his story. The PowerPoint I'm going to show you is actually one that he created himself. And he recently shared with his entire company. He's CEO of a biotech company called Ignita, based in San Diego. They have over, I think, 140 employees. And at their monthly meeting, he shared his story with the entire group. So let's see if I can pull it up.
There you go. Okay, great.
Can you hear me, Gustavo?
Yes, we can.
Okay. So this is not my presentation, it's my brother's, but I'll be presenting on his behalf. And the reason I wanted to share this also is because I did get a question just about the ketogenic diet. And so I thought I could somewhat answer it in the course of this presentation. So my recent wellness journey, and he presented this on September 1st, so just this past month. In college, Jonathan weighed in the 170s, but this reached a high water mark at the end of 2010. As you can see, he's in the 1990s, he was 175. That was when he was in college. And then 2010, he weighed as much as 188. And just so you know, he's about 5'9.5". Okay, so this put him just in the slightly overweight category, not even obese. So he started a low carb ketogenic diet, and ketogenic diet is a diet that's very high in fat. 70-80% of your calories oftentimes will come from fat, and then very low carb, usually less than 50 grams per day, and low to moderate protein. But look at he did experience some pretty dramatic rapid weight loss. So he went from 188 all the way down to 158 pounds in over a few months. In terms of what he was eating, at the bottom of his pyramid was a lot of animal products, eggs, fish, red meat, chicken. He did have a lot of vegetables. So I do want to point out that one of the good things about a ketogenic diet is it does move from processed foods. It does emphasize generally whole foods, though oil is, I think, an exception. But it also does include a lot of leafy greens, and that's all good. Fruits are minimized to just berries. And then as you can see here, oils, cheese, and carbs are very much minimized, the complete antithesis of a starch-based McDougall plan. Eventually, as is often the case on a ketogenic diet, it was difficult to maintain that. And so he slid a little, and his weight kind of bounced up to 165 and then 170s. But what was most concerning was what happened with his cholesterol. So his cholesterol got as high as 242 total cholesterol with an LDL of 180. And this was in June of 2013. Even after he kind of backed off it a bit, his cholesterol still remained high with a total cholesterol of 211 and an LDL level of 146. So the big problem in terms of a ketogenic diet is there's an emphasis on meat, which is full of saturated fat and other pro-inflammatory substances. This is a famous double animal style, protein style burger at In-N-Out. That's not actually a menu item. You have to order it off the menu. Bacon, chicken, ribs. And then the other big problem is that it cuts out lots of the core parts of a whole food plant-based diet, right? So legumes which have been shown to be a core part of the diet of civilizations all across the world that have thrived over the centuries. If we look at Dan Buettner's book, The Blue Zones, where he looked at around the world at populations living well past 100 and thriving, one of the key components was legumes, whole grains, fruits, certain types of vegetables, especially the starchy vegetables like winter squash. All of these are off limits on a ketogenic diet. So he relaxed his diet even further, and his weight started creeping up again till it reached again another high water mark of 179 in June of 2017. And his weight gain actually exacerbated his chronic low back and joint pain. And it's kind of sad, but it's also funny. It came to a head at Ignita's holiday party one year where he was just carrying his laptop. And all of a sudden his back gave out on him. And he actually had to use a cane. And my brother's just five years older than me. I'm 40 years old. He's 45. And he was completely incapacitated, even bedridden for a short period of time. And so we actually were talking on the phone back in June, and he was talking to me about his back pain. And I told him, I was like, Jonathan, there's no question in my mind that if you were carrying around a 20-pound bowling ball, 15 to 20-pound bowling ball less of weight, that your back pain would be significantly improved. And so he's like, yeah, well, how am I going to do that? Like, you saw what happened when I went on the ketogenic diet. I lost weight, but my cholesterol went sky high, and it was hard to maintain. I said, well, what I want you to do is for 3 weeks, just give me 3 weeks of doing a 100% whole food plant-based diet. And I got to get you over this misconception that starches and carbohydrates are the cause of your weight gain. What I do want you to get rid of are the processed, refined carbs. So, he needs to give up the Twizzlers that he was eating after dinner every night. He needed to give up the Marie Callender's strawberry pies that he would get on a regular basis. So he has to differentiate between healthy carbs versus unhealthy carbs. But I absolutely want him eating lots of whole grains and starches that are rich in complex carbohydrates. Well, he decided to follow my advice. He thought I could do anything for 3 weeks. And what he experienced was a very dramatic, rapid weight loss. One of the more dramatic, honestly, that I've seen in someone who is not significantly overweight. A weight of 179 with a height of 5'9", it's BMI probably I didn't calculate it, but it's probably about 26, 27. So he was just in that barely overweight category. And despite that, just from switching his food, and I told him to eat as much as he wanted. So what we call an ad libitum diet. I said, eat till you're satiated. You could see that over the course of 2 months, he basically lost over 20 pounds. And so he went on to explain to his company what is a whole food plant-based lifestyle, which I'm not going to get into. But he contrasted that, but this is what it is not. He had a Doritos challenge. This is the kitchen at his Ignita office. They had a Doritos challenge. So clearly this is not part of a whole food plant-based diet. And these are the new 4 food groups that is part of his daily lifestyle now: fruits, vegetables, whole grains, and legumes. And so now his breakfast looks like something that he had completely avoided for many years. It's oatmeal with bananas and blueberries and maybe a small amount of nuts. He eats a lot of salads, sort of a balanced meal of beans and rice and vegetables. It's funny, these pictures are actually pictures of what I've eaten, but he was too lazy to take his own, so he used mine. Weight loss seemed to be working, but what about his labs, right? That was the big question in his mind. So he had lost weight, but he had done this before on a ketogenic diet. He was curious about his cholesterol. And so if you remember, his total cholesterol was a high of 242 with an LDL level of 180. When he backed off a bit, it dropped a bit, but still very high with a total cholesterol of 211 and an LDL of 146. Well, he checked again recently. I had actually wanted him to wait because oftentimes your cholesterol can be a little bit high as you're losing a lot of weight. So I think it's actually going to end up even lower, but he couldn't wait. And so he checked, and look at the drop. He dropped from 211 all the way down to 176, and his LDL from 146 down to 118. This is the lowest his cholesterol has been over the last 5-6 years, and a very notable drop from where he was eating at his high cholesterol mark when he was on the ketogenic diet, a significant drop from the high of 242. And this was a picture of him on June 1st, 2017, at a Warriors game. And this was before he had adopted the whole food plant-based diet. And that's him 3 months later, August 31st, 2017. And what's also notable is that in addition to weight loss and normalization of labs, his other key benefit has been a significant increase in activity. So he has no more joint pain or back pain. He's resumed his previous physical activities. And for the first time in a long time, he's able to do something he had kind of given up all prospect of doing again, which is a pull-up. I'm a huge fan of pull-ups because it's looking both at your strength, but relative to your body weight. So I've always found it a little not too impressive if someone can bench 400 pounds, but then can't lift their own body weight. So I like the pull-up for that reason. And I used to not be able to do a single pull-up in my life. This morning I did 9 pull-ups. If you're not working on pull-ups, then consider adding that to your exercise regimen. And then he ended his presentation with Hippocrates, "Let food be thy medicine, and medicine be thy food."
Very good. Wonderful.
So I just, I can't tell you how exciting it has been for me to witness my brother, who was a very passionate paleo, ketogenic, and they are different. I'm not going to get into the differences between a paleo diet and ketogenic diet and low carb, but they're kind of, I put them all in that genre because they all emphasize low carbs. To go from that whole area to now a very passionate whole food plant-based advocate, to the point that he's sharing it with his entire company. And I just talked with him this morning, actually. And he told me that he got more questions about that presentation than he had on any other, presentation he had given, which shows the level of interest that people have in healthy eating and nutrition, and addressing the core root cause of their illness, whatever it may be, whether it's back pain, high cholesterol, gout, peripheral arterial disease, heart disease, to really getting to the root cause. Because what I could have told my brother when he called me back in June is, well, dude, why don't you do some physical therapy and take some ibuprofen or naproxen as needed, and do some stretching, right? But I knew that's kind of dancing around. That really, to get to the root cause, I needed to help him get to a healthier weight. You saw the pictures, what a notable difference in a few months. I had to help him get to a healthier weight. and eat a healthier diet and decrease the overall level of inflammation that was going on in his body. And so if we circle back to one of the patient's original questions on the concerns I have with a ketogenic diet, I already mentioned that I do think there are some benefits. I think the fact that they cut out processed food is huge. Same with paleo. The fact that the paleo and ketogenic diet cut out processed foods is a huge win because it puts the emphasis on whole foods. And the fact that there are many people eating a ketogenic diet that eat lots of green leafy vegetables, I think, is also great. But this emphasis on the basically limitless amounts of fat and oil, which I've already just talked about, is and in the paleo diet, limitless amounts of meat products, no matter how high quality the meat product it is. I think raises long-term health issues, even as serious as death. There are multiple studies showing that over the long term, there is an association of being on a low-carb diet and increased rates of mortality. So that's the most serious. And then in between that, we've got increased risk of kidney stones, increased risk of osteoporosis, increased risk of constipation and general gastrointestinal disturbances, nausea, vomiting, diarrhea. These are all, bad breath, halitosis. So from the mild to the severe, I think that when it comes to ketogenic diet, people need to focus more than the physical manifestation of weight loss that's occurring and be concerned about what is actually going on underneath their hood, what is going on in their arteries, in their gut, inside the body that is potentially or very likely compromising their long-term health. And whenever in doubt, if we just get away from the studies, I always like to look at I get this from Dr. McDougall. Let's just look at populations around the world that are thriving, and if you haven't read Dan Buettner's The Blue Zones, then read it. The populations that he studied, whether it's Okinawans in Japan or Sardinia, Italy, or Loma Linda, California, none of them are eating a high-fat, low-carb diet. They are all eating a diet that is 90% or more fruits, vegetables, legumes, and grains. So why do we keep trying to find some new fad to hop onto? Why not just stick with what has worked for across the span of history, and keep things simple, and adopt a lifestyle that is very well supported by the scientific literature.
Very good. Thank you so much, Dr. Lim.
No problem, Gustavo. It's my pleasure.
Yes, and I want to remind people that if we haven't gotten all the questions, obviously there are so many questions here, to keep emailing those questions at the email that we have for questions, which is webinar@drmcdougall.com. And when we have you back again, we can do more of those questions. I hope that we'll have you back soon. And thank you one more time. I really appreciate this. And I know everybody has loved your presentation here. I can see the comments.
All right. Sounds good. Sorry about the snafu midway through.
That's all right. Well, everyone, Dr. McDougall is going to start a series in the month of October where we will be talking about health issues for women. And so you've all been asking for this. So it's here. So you will be able to sign up for next week's webinar in a day or two. The link is going to be on his website as usual. And we'll see you next week with Dr. McDougall. And hopefully we'll see you, Dr. Lin, really soon.
All right. Take care.
Have a good weekend, everyone. Thank you, Dr. Lin. Bye-bye.